but the insurance is
It's cover any aspect.
is for what? Insurance is for that to prevent you to spend more money. Not just they want you, they of course they want you to spend money, but they also help you to prevent you spend more money, right? And I think you get sick or meet some disaster is like a lottery, right? It's you winning a lottery, or you're lucky. It's a very small chance, right? But I can guarantee that in my life I can't win a lottery, but you can guarantee in your whole life you will not get sick or disease or any disaster at all, right? And for this, so the insurance money, this is means insurance, and the insurance money spend less than you have no insurance money in any situation, right? So if you treat insurance like you said some children or people they can afford insurance, but some sick people they can also pay for their disease, their treatment, right? And so this insurance is minimize the risk of all the situation. So we think it's expensive. You think that 1,000 is expensive than 100, but 10,000 is it expensive than 1,000, right? If this is what your treatment cost you without insurance, and this is your treatment cost with insurance, which one you choose, right? This is our point. Thank you.
So I want to support again, and then you said for everyone have a different necessary. But even if the government told you this, the health insurance you need to pay for money. But this insurance I think is very basic insurance. If you have different necessary, like Jiren said, she want to sell the dentist, doctor, you can buy another insurance to support you. This is
I want to add another sentence as the last sentence, don't bet with your life, like you don't want to be gambling with your life. That's all.
Okay, great. So now we'll move on to the counter argument. So team 2, if you would like to argue against anything that team 1 has said, and then vice versa, team 1, you can argue against team 2 as well.
No, we have no question. And then next, I will ask. So after the question part, we need to give another point.
No, I need to counter argument for this.
We have 2 point of view, didn't say. Oh, have
Okay.
1 point of view, didn't say.
Okay, yeah, so you can have the you can say that point now if you want to. Yeah.
Okay. So yeah.
This is introduction.
Yeah.
Okay.
Hello everyone. Today my point against is for the government influence. When the company is paid, the expenses are also direct to the taxes charged by the government. This implies still having to pay even more for a car insurance. Let's say that a person buys his own car. Then he has to pay for a driver's license and finally take out insurance for his car. But he still has to pay the taxes that come from the government. So it's obviously that not everyone has the facility to pay so much money. And let's say that some one of them are parents or even students like us. So that's it.
Okay.
Okay, thank you. So, okay, before we go on to the conclusion, actually, I want to ask a question for each team. So I will start with Team 1. I have a question for you. Okay, so do you think that health insurance should be provided through the government or through private companies?
I think maybe the main insurance maybe from the government, and another if we want to add some extra like insurance, you can buy at another companies.
Okay, so like we talked about dental insurance, like certain things that could be through private company, but the main insurance you're saying should be through government.
Yes.
Okay, thank you for answering that question. Okay, for this team, I have a question. Do you think healthcare is a basic human right?
I think is basic human rights, but it is not affordable for everyone because it's too expensive. And we are like student. I give all example. We are students, and I give all semester every 4 months $1,200, and this is already expensive. And also I visit the hospital. I give $15 and also give medication and other charges. And everyone know in the January I had little bit surgery, just crash, and this is too much expensive for me. They give me right now. Yesterday they give me another bill is a $160. Is so expensive for me. That's why it's like expensive. All international students and also is native students. Yeah.
Okay, great, thank you. So now we'll go on to the conclusion, and Team 1 will begin. So you will end with your summary of your arguments, and then if you want to make one more point, you can do that as well.
I just want to introduce my experience of the see a doctor. I remember when I go to see it's the rhinitis, yeah.
Nose disease.
Yeah, nose
Oh,
disease.
okay.
Yeah, the price of the same the medicine is the survey time very expensive. The without insure, I think the one is the medicine I pay the $15. If no insure, I want to pay it's the $200. The same the medicine. The before 1 month, my friend mom is the mom is the 2 days in hospital. Is the paid $15,000.
Wow.
2 days in hospital, but he didn't pay a penny with insure. It's cover. It's the he is the no pay every money. I think in the United States there is the no health insure. In my views have the concertable financial receipts. You'd better take out medical insurance to private the huge the medical expense you have to face in the event of the satellite illness or injury. I just introduce my experience. If you don't
think you should buy insurance, so which way do you think is the better? The question.
Oh yeah.
Okay, great. Thank you, Lily. All right, so anything else from Team 1?
We think that our will is that people's body is like precision instrument. It's like a mobile phone or a car, and the mobile phone is made from iron and plastic and glass, and the car is all made from metal. So our body is not as strong as the metal, right? But if car requires to have insurance, so please treat your bodies like a precision instrument, and then take care of your body and get insurance for your life, for your health. This is our will.
Great. Thank you so much. Okay, Team 2.
Fellow teachers and classmates. Good morning, everyone. I am Caroline. Our team disagree or taxpayers should be required to have health insurance. There are some conclusions. The first one, waste money. The majority of health insurance policies do not cover all diseases and disorders. Like we need to pay $15 for each hospital visit, as well as various fees for blood tests and other medications. So, and the amount is automatically cleared after 1 year. The second one, not everyone can afford the cost. It is so expensive. Healthcare costs a great deal. Medications cost nearly 4 times as much as in the US as much as they do in other developed countries. And the third one, we think the government is hard to realize the universal health care. Though the most opposed industrial westernized nations employ a universal health care model. Different religions in US are defined by distinct cultural identities. Citizens have unique religious and political values. Moreover, different climates and population densities confer different health needs and challenges across the US. And the implementation would not be as feasible organizationally or financially as other developed nations. There is a need agreement that realization of universal health care in the US would necessitate significant upfront costs, like physical and technological infrastructure changes to the health citizens and expansion of the range of services provided. All in all, disadvantages of universal health care include significant upfront costs and logistical challenges. So, our team disagree or tech players should be required to have health insurance. Thank you.
Great, thank you. Okay, anything else, Team 2?
No, we just disagree about the health insurance.
Okay, very good.